is Dr. Kiran Shah. I am a diabetologist from Mumbai. It's a privilege for me to be speaking today on diabetes, heart, and the impact of diabetes on heart. Today we will be discussing on how to take preventive measures to prevent cardiovascular complications in patients associated with diabetes. We all know that diabetes affects, or basically uncontrolled diabetes has numerous complications, may it be the brain, the eye, the heart, the kidney, the lower limbs. Each of these complications usually occur when diabetes is uncontrolled. So today our focus is going to be on preventing these complications, especially when it comes to the heart. Heart disease remains the leading cause of hospitalization and deaths in patients with diabetes. It is also said that patients having diabetes are equivalent to having cardiovascular diseases. Although most people have heard of heart disease, very few of them understand what exactly happens or where exactly it is involving, and in turn it may not be taking proper steps to reduce the risk of heart disease. Cardiovascular diseases occurs when the blood circulating in the heart is slowed or stopped because of blocked artery. The reasons behind this is cholesterol or atherosclerosis in medical language. But what we need to understand is beyond this, there is another contributing factor, which is diabetes. Diabetes is a lifestyle disorder. It's a chronic condition wherein the body's ability to control blood sugar level is not there, or insulin is unable to control or take care of the blood sugar levels in a simple language. Usually when you eat food, the glucose will enter the blood stream and from the insulin will be secreted immediately, and this insulin which is secreted will take care of the rise in the blood glucose values, hence you are normal. However, in patients with type 2 diabetes mellitus, these patients, either the insulin is not secreted adequately or the ability of insulin to break the glucose does not take place, hence the blood glucose levels rises. When it comes to diabetes, prevention is very important. It can affect your entire body, as I said earlier, right from the brain where it causes stroke, in the eyes where it causes loss of vision or blindness, in the heart where it can cause heart failure and heart attacks, in the kidneys where it can cause end stage renal disease, or it is also called kidney failure. In the legs, it may be from loss of sensation to tingling to numbness to ulcerations, and finally it may lead to gangrene. So left uncontrolled diabetes particularly causes lots of complications, and a good controlled or a well controlled diabetes is a leading cause of nothing. People with diabetes are twice as likely to have a heart attack or a stroke as people without diabetes. It is reported that among people at the age of around 65, approximately 68% of them will have heart disease. The chance of developing heart disease among people with diabetes is not dependent upon how well you manage your blood glucose values. So when we think about diabetes, we should really think about heart disease as well. High blood glucose values can damage the blood vessels, worsen the cholesterol, and make the blood pressure more difficult to manage. Persistent high blood glucose levels due to diabetes makes the blood vessels more prone to atheroma or atherosclerosis or bad cholesterol. This condition leads in narrowing of the blood vessels, which in turn the blood will find it difficult to reach the target organs, and hence you have what is known as a heart attack. A sudden stoppage of blood flow to the heart will also cause a heart attack. There are a number of things you can do to lower your risk of heart disease. Understanding the connection between diabetes and heart disease is the first step towards prevention. Diabetes is commonly known as a lifestyle disorder or a chronic condition which would always remain with you. Managing diabetes requires patients to make significant changes in regards to their diet, with regards to their exercise, and taking adequate medications which are prescribed by the doctor. One can control blood sugar levels to lower the risk of cardiovascular disease by eating adequately or healthy food, engaging in physical activity or regular physical activity, regular blood glucose monitoring, quit smoking, and relieving stress. One should understand the ABCs of diabetes. A is for the glycated hemoglobin, or the HbA1c test. The A1C is a blood test which helps us to manage or tells us about the average blood sugar value over the past 3 months. It is different from your daily blood glucose values or even the fasting and the post blood glucose values. The A1C goals depends upon individuals. Younger individuals should have an A1C goals which are much more stricter as compared to individuals who are going either elderly or associated or they have an associated medical conditions. It will be different for each and every individual. As I said, the A1C goals has to be individualized. B is for the blood pressure value. Diabetes itself and hypertension or blood pressure are like brother and sisters. They go hand in hand. Blood pressure is the force of your blood against the wall of your blood vessels. If the blood pressure is too high, it will make the heart weak and possibly lead to heart failure or heart attacks. The blood pressure goal is again individualized, as I said, related to diabetes, but it is at a target of approximately 140 to 80 millimeters of mercury. It may be different for you. As I said, it can be individualized. C is for cholesterol. There are two kinds of cholesterol. One is the good cholesterol and the bad cholesterol. Many times we come across where the patient does only a total cholesterol or a serum cholesterol. This value does not help us in identifying which cholesterol is good or bad. When you do actually a cholesterol, you should ask for a lipid profile. So when we see that, we see the LDL, the non-HDL and the triglycerides and the VLDL, which are considered to be bad for the human body. They are bad basically for the heart, the brain and the vessels. These basically contribute to your stroke and the heart attacks. The HDL is also considered to be the good cholesterol. So higher the HDL, lesser will be your risk. But it also again depends on various other contributing factors or various other medical conditions, and I'm quite sure that the treating doctor will help you reduce your blood cholesterol values. Eating healthy and well balanced diets forms I would say it forms the top of the pyramid. You need to switch butter and ghee for unsaturated vegetable oils and spreads such as sunflower, olive, rapeseed or corn. Trim visible fat from the meat and remove the skin from the chicken. Choose lower fat milk and dairy products and swap biscuits, cakes, chocolate for healthier snacks such as fruit. Try to avoid packaged foods. Try to avoid cold drinks, soft drinks and including alcohol at times. Remember, fatty foods are high in calories and excess energy, which results in weight gain. To help you manage your weight, it is also important to keep an eye on the total amount of fat which you are consuming. People always ask about what kind of oil should we use. I would always say it is not the kind of oil, it is the amount or the quantity of oil which you are going to be used while cooking. You need to eat right. Avoid refined white wheat bread, cereals, potatoes, chips, fried items, red meat, processed meat, sugar sweetened beverages. Eat foods which are healthier with regards to their fiber content, whole grain cereals, dairy fruits, beans, legumes, lean meats, fish, nut, healthy oils. Choose fruits, green leafy vegetables and other cereals and low fat or skim milk or cheese. Too much salt is not good for the heart because it increases the blood pressure. It's a continuous event which in turn will cause cardiovascular events. Most of the salt we eat is already there in the processed food. So adding salt on the top of your food is not advisable. Check the labels and go for those with the lowest salt content. Learn how to read food labels which may help you to protect or make your healthier choices. Remove the salt shaker from the table or avoid adding extra salt. You can add pepper, you can add lime for bringing out the real taste. So there are some tips for diabetic patients which they should consider. Eat balanced meals, eat reasonable amount of calories, eat at the right time and eat slowly. Losing weight always helps us with regards to decreasing diabetes, blood pressure and specifically cardiovascular diseases. You need to work out regularly. It does not matter what is the intensity, but always the regular exercises is always going to help us improve the insulin sensitivity and thereby reduce the blood glucose values and thereby prevent us from developing cardiovascular diseases. This can be in terms of aerobic exercise such as walking, swimming, cycling. Medical treatment: take your medications which are advised by the doctor eat meals and take medications regularly at time. Always remember there is always going to be a risk of hypoglycemia, so do not avoid food by after taking medications, because at times hypoglycemia per se can induce cardiovascular disease or heart problems. Smoking increases the risk of type 2 diabetes, mellitus and diabetic complications. Smoking is not going to help us with regards to preventing heart diseases. It will always increase atherosclerosis or cholesterol, disturb the cholesterol values, and thereby always contribute to your heart conditions. Need to cope up with stress. I would say yoga is good, but do not do postures wherein you are uncomfortable to do it. Stress is known also to increase the blood glucose values, which is known as stress diabetes. Instead, try meditation, deep breathing, another relaxation technique in a healthy way. Sleep is the most important part as far as diabetic patients are concerned. Adequate sleep of approximately 7 to 8 hours daily is a must as far as diabetes is concerned. The bottom line is that diabetes may lead to serious complications, including cardiac issues, but we can manage the conditions with medications and lifestyle changes. Avoid most common diabetes complications with preventive tips. Thank you very much for your patient listening.